We heard so much great information the first half of today, and now I'm particularly biased but excited about this next presentation because social workers are such an integral part of the team, and it's similar to occupational therapy really in a way where so many people don't know what we do and so much behind the scenes. But to speak to the more emotional and psychosocial sides of these journeys, while you're also navigating the logistics and the physical journey of it, are social workers. And Lauren Zelouf is on the team at Penn Medicine, and she's going to speak to the role of the social worker and supporting families. So thank you so much for being here, Lauren. And we'll do what we've been doing the first half of the day. Just as a reminder, we will be sending everyone slides later tonight. And we're going to save the last few minutes for questions at the end of this presentation and the next one. And then we're going to have a panel as well. So thank you, Lauren.
Yay. Well, thank you so much for having me. I love seeing people that I know, people that I haven't met before. It's really great to be here, so thank you to CurePSP. So today I'm going to talk about the role of social work, serving patients with MSA, PSP, and CBD, and care partners, and how I can be of a support to all of you. So I have not used this before, so let's see how this goes. Okay. So I want to first mention and explain what social work is, right, before going into my role specifically at the center. So according to the NASW Code of Ethics, the primary mission of social work profession is to enhance human well-being and help meet basic human needs of all people. Additionally, a historic and defining feature of social work is the profession's focus on individual well-being in a social context and the well-being of society. So that basically means that we're all constantly impacted by the world around us, by the people we interact with at home, at work, in our communities, and all of these outside forces impact the individual. And as a social worker, I really see out of the lens of person and environment. So what that means is me, myself, and all of you are impacted by the environment that you're in and how our environment kind of impacts how we navigate our world. So I kind of wanted to just share this is the lens or the framework that I see out of, and this guides my clinical practice. So I also wanted to introduce kind of my role as social worker at the Parkinson's Disease and Movement Disorder Center at Penn, and I really see my role as supporting patients and care partners wherever they are in their journey with their atypical Parkinsonism. So again, the social work idea is that we really meet people where they are and what they need in that moment. So I'll be sharing 4 different practice areas that I can help with. And that includes providing emotional support and therapeutic intervention, providing education, psychoeducation, helping with long-term planning, and then also with connecting people to resources, which I think largely what people think social workers do only, but there are many other things that I can help with as well. And I also wanted to mention limitations. I mean, of course, we're here to talk about multidisciplinary care. So I wanted to mention that there are sometimes when people have questions that confront me with a question I can't really answer because it might be outside of my scope of competence. And that's when I really look to my team members and their expertise and their knowledge to see if we can work together and help answer that person's question. So for an example, which I know this already came up, but the occupational therapist we know can help with sleep hygiene. Or helping with, let's say someone is having trouble with structuring their day, or they're having trouble managing anxiety. So these are all areas I might look to the occupational therapist to kind of help guide someone in terms of kind of figuring out their daily structure and daily routine. Another area this often happens is when a patient or a care partner will ask me, what's the best device for me to use? So I know that Heather can't, explain this, but often someone will say, I think I should use a motorized wheelchair because of falls. And that's when I typically look to my physical therapist and say, what do you think? What do you recommend? What do you think is safest? So we really do work together and collaborate, depending on what their expertise is, and making sure to really pull from them if I don't know the best answer. So that the idea is that we collaborate. Okay. I love this image. So as you can see, this is Winnie the Pooh, and Pooh is saying, Pooh, what's the bravest, or this is Piglet. Pooh, what's the bravest thing you've ever said as Piglet? Help, said Pooh, which I think is really sweet, but it's also really important to mention that when I meet with patients and families, I really do like to mention how much courage and vulnerability it takes to ask for help. So I just would like to acknowledge that. And I think this image does a good job of it. So when I say that I provide emotional support and therapeutic intervention, what does that mean? So I would say first, kind of at the basis of social work, I'm assessing someone's psychosocial needs of the patient, of the care partner, and this really includes all of the areas that contribute to your well-being. So in this case, I'm focusing on social and psychological functioning. So that means I might be asking, what does your support system look like? Do you have people that you can confide in, people that you can rely on for support if you need it? And in terms of your psychological functioning, I might be thinking about how's your mental health? You know, do you have healthy coping skills to help you in terms of managing your day-to-day? That might be really unpredictable. Another big piece is grief and loss. So when I'm talking about grief and loss, that can mean different things to a patient and a care partner. Often I hear from care partners the idea of anticipatory loss or anticipatory grief, kind of thinking about the future, that this is not what you expected, and thinking about things that you might not be able to do or at the same level that you used to be able to do, such as travel, for example. With patients, I hear a lot about loss of independence, especially when you first get this diagnosis, and loss of identity, control of your body or your bodily functions. That's a big loss. And so my role as a social worker is really to acknowledge that and normalize that. That's real, it exists, and I'm here to support you and help you cope through that. Another thing on here that I included was changing roles and responsibilities. So with any disease, right, you're kind of, as a care partner as well, you might be noticing a role reversal. Maybe your spouse or, never did the bills, and now, or you never did the bills, I'm sorry, and your spouse, that was always their role, and now you're kind of taking that on, and that was not something you used to do. So kind of adjusting to changes, and again, that can be really overwhelming. So I just wanted to acknowledge that that's a part of the disease journey, and I'm here to support you through it. So I know we already mentioned this, but that the care partner and family members, whether you're an adult child or you're a spouse, you're a friend or a cousin, whatever that your relationship is, we want to make sure that you feel supported. This journey can take a toll on you, as you already know, and we want to make sure that you feel you have the tools and the knowledge, and also just the support in general from us to know that you're not alone, and we're going to guide you through this. I wanted to mention on here, if you are feeling overwhelmed or you're feeling like it'd be helpful to hear from other people experiencing this, we do have a lot of support groups at our center. I actually facilitate, I mentioned, a support group for adult children that have a parent with either Parkinson's disease or an atypical Parkinsonism, which all of our groups are virtual. I also coordinate our Care Partner series, which is a monthly speaker. We have educational professionals that come in giving a talk every month. It's a virtual program where we have elder care attorneys and yoga therapists and occupational therapists, and really everyone kind of giving you the tools to empower you throughout this journey. So we have a lot going on. I also refer people to our counseling program. I'm one of the counselors. And then sometimes I help to facilitate family meetings. So that might look like if you're kind of within a family, there's always interesting dynamics in any family. And let's say you're having a conflict and not struggling to get on the same page about the person's care. It might be helpful to bring in a social worker to help with facilitating that conversation and getting on the same page. And sometimes I provide crisis intervention, so that might look like if someone is having a mental health emergency or a crisis, I might be able to intervene, helping come up with a plan, whether that's connecting someone to resources like a psychiatrist or a psychologist or a social worker therapist, kind of helping in that situation. So in terms of education, what that looks like. So sometimes providing education is just simply assessing someone's level of understanding of what their diagnosis means and the symptoms that go along with that. And providing education not only to the person that's experiencing it and the family, but it might also be to outside providers, right? I mean, we already talked about this, that oftentimes you might be in the hospital or speaking to other doctors or therapists and they don't understand your disease. So something that we do offer is providing education to that person so that you don't have the burden to do that yourself. So I always offer that. If you're meeting with a therapist, for example, I'm happy to provide education on your disease. It's more important that you guys you click, right? And feel like safe to just share with that person, but taking away the burden to have to educate them. We can do that with written consent. And then another piece is, assessing for mental health issues. As Dr. Jake had said earlier, is that we often see anxiety and depression as symptoms of these diseases, but also because of them, right? You're living just a challenging experience. So making sure that we identify if there are mental health issues and connecting you to resources appropriate for them. I mentioned to introduce healthy coping skills because I wanted to mention that we all have our own coping skills, right? We already come in, you've maybe dealt with other difficult experiences in your life, and you're already resilient, but making sure that if you're noticing that you're becoming stressed at a certain time of day or you're having trouble falling asleep, that we can kind of talk about what are some strategies. Maybe it's mindfulness, meditation or breath work, but, kind of discussing what are other options out there. And then this is a big piece. So, when we're talking about understanding healthcare systems, what I always say is that you don't actually know it or learn it until you're in it, which is not very helpful. And so you're kind of learning on the go. And so I'm kind of tasked with helping to educate you on what the system is like, what the different levels of care are, such as what's the difference between palliative care and hospice, or kind of what's the difference between Medicaid and Medicare, and what does Medicare cover and what does it not cover? It's a big question I tend to get. And then kind of help me understand my insurance coverage. So these are all kind of big questions that are confusing and complex, and I'm kind of here as the educator and helping you understand them better. Long-term planning. So long-term planning, I would say, is another big question I get, especially at diagnosis. And I think it's really important to remember that now is a really good time to have those conversations, right? And making sure that you're sharing your wishes, your values, what's important to you with your care partner and with your family members. And that might include, figuring out where you live, what kind of care you want to receive, who you want to make decisions for you if you can't speak for yourself. So in that, I included the advanced directives, like having a living will, appointing a durable power of attorney for healthcare, and also having a financial power of attorney. In our clinic, we sometimes give out what's called the 5 wishes, which is a type of advanced directive. It includes a power of attorney, so identifying that person who would make decisions on your behalf, and then also a living will. It goes over, what kind of medical care you would want to receive at end of life and what kind you do not want to receive. So I think it's really helpful. It's really nicely laid out, and I just wanted to mention that. sometimes long-term planning might include talking about, if you are still working, kind of what that looks like in terms of reasonable accommodations, disclosing your diagnosis at work. Again, getting accommodations and then going through the disability application process if that's where you are in your journey. And then the last part of long-term planning, which I think is the biggest part that I talk with folks about, is discussing future plans and goals in regards to living arrangements and care needs. Because as your care needs change and anticipating that, what kind of care will you need? So some questions that, to keep in mind that we might explore together would be, would you consider bringing care in at home? And who would provide that care? Is it a family member? Is it a neighbor? Is it someone from your faith-based community? Would you hire help? Do you qualify for any services? And I know before what was mentioned was the ombudsman. In terms of finding out if you qualify for any services in your county, there's an area agency on aging in every county in the country under the Older Americans Act. So if you want to find out about resources in your parents' area or in your spouse's area, you can actually just Google, for example, Philadelphia County Office on Aging or Area Agency on Aging. So wherever you are, you could just Google that, and you'll be able to find your Office on Aging for resources. And that's for 60 plus, but it's also for people with disabilities, so you could find information there even if you're younger than 60. So these are all kind of questions just to keep in mind for the future, and it's good to kind of think about it now. I actually went to a conference that Jessica and I were both at, and one of the social workers there said something that it's stuck in my head. Every worry needs a plan, which I think is such a great statement because it's true. Once you have a plan, once you have that advance directive written, you put it away in the shelf and it's done, right? And if you need it, you pull it out. But once it's done, you can feel reassured. You have a plan. Resources. So this is what most people think that social workers only do, which is huge. I don't want to minimize it, but we do much more. So in terms of resources, that includes providing what's available in your area. So I just mentioned Area Agency on Aging, which has a lot of resources of what's available. But through experience and through working with people, kind of mostly PA, New Jersey, and Delaware is what I know, but I can also research on other areas just by looking on the Office on Aging. But I can also provide a basic financial assessment of what you might qualify for. So common questions I'm asking is, do you have long-term care insurance? Are you a veteran? Do you qualify for Medicaid? And kind of assessing what you might be eligible for just based on that information. And then sometimes if I don't have all the information, you might need some help with planning for the future with Medicaid planning and asset protection, I might refer you to an elder law attorney, for example. So that's kind of what the next part is about, is being able to connect and make referrals to community resources if that might be necessary. I know Suzanne before brought up meeting with a geriatric care manager. So what might be helpful, especially for if, as an adult child living far away and really wanting to make sure that your parents' care is being managed properly, it might be helpful to bring in a geriatric care manager who can help coordinate that care, be on the ground, go to the hospital, if they're in the hospital, or calling in home care agencies to make sure that your parent has the care they need at home. Calling the doctor's office, the primary care physician, making sure that everyone's on the same page. So it is out of pocket, but it could be helpful if you can afford it. So just to kind of go into my role specifically at the COPE clinic, so I might be providing all of the above, right? Everything that we just mentioned, even though I'm only meeting with you for 30 minutes. So I kind of have to figure out what's the priority and what the person's need is. And in that, I'm assessing. I usually try to start out by finding out how are you coping with your diagnosis, especially if it's new or just in general, how are you, right? Being able to kind of have that one-to-one conversation. And also assessing if you feel like you have sufficient supports. So that might mean, do you have a family or friend or neighbor support system? have you considered hiring professional help or do you qualify for anything? Kind of going back to that, making sure you have what you need. I could also be providing education, just like we talked about, of the healthcare system or about your disease, providing support, and then connecting you to resources as needed. So I mentioned here communication and collaboration with team members. That's why we're here today. And I do that a lot. So during clinic, before clinic, after clinic, usually the point of contact. If the doctor recommends palliative care and then I kind of share that with the family and then they tell me we're really not ready for that, that's key, right? They might not have shared that with the doctor, but kind of part of my role is assessing someone's readiness for the next level of care. I might educate them. What does that even look like, right? So I'm kind of taking what's recommended and breaking it down to make it understandable for the patient care partner. Sometimes in clinic, our physical or occupational therapist might recommend a home safety evaluation. Maybe we have concerns about the person falling. We want to make sure that the environment is set up for them. My role might be explaining that to the family and explaining what agencies provide that. What does that even look like? Will my insurance cover that? So kind of taking what's been recommended and suggested and breaking it down. Oh, and then lastly, I just wanted to mention the post-clinic follow-up. So this was mentioned before, but usually in terms of my role for clinic follow-up is after I met with you, I'm giving you all this information. I'm the kind of person I like writing everything down or I'm not going to remember it. And so I make sure to send an email after clinic, usually in the form of an email to kind of what resources, what support groups, counseling, what's out there. And I want to mention that can be kind of overwhelming, all the information that's out there and all the support groups and all these offerings. And what I try to kind of tell my patients and care partners, a reminder, is that this is your choice how much you participate in, right? That's what you have control over, is how much information you're filling your mind with and how much you attend. It can get pretty overwhelming, so you decide what's the priority, how much you want to participate in. So in addition to the email, we also send out a letter with recommendations from each team member so you have something to look back on and refer to. And that's my contact information. That's my direct number, my email, and the star was only if you are a patient at our clinic. If you're being seen by one of our movement disorder specialists or a provider or nurse practitioner and you want to speak with a social worker, you can always have them refer you back to me. Any questions?
Thanks, social worker Lauren. That was great information. I saw a lot of people nodding and taking copious notes, so thank you. Questions for Lauren? Hey.
Hi, thank you. If a patient is being seen by a clinician at Perlman Center, do they still have your expertise for a resource? Like, I didn't know anything about the COPE clinic, and we were referred to UPenn, and he was set up with a neurologist at UPenn, at Perlman Center, who's been fantastic. But I don't feel like we have a whole care team there.
And I'm assuming you're referring to the Penn Memory Center, is that right?
The Perlman Center for Advanced Medicine.
Okay, because that's where that is. So it's possible there might already be a social worker in that center, but yes, you can, even if you're at another area in Penn, you can still reach out to me. And I actually wanted to mention that for people who are not connected to us, if you're living outside the state or you're not a patient at Penn, I'm still a resource. I actually get a lot of reach outs from people who are not a part of our center. So I'm happy to be a resource and support to you. You can still join our care partner groups and our counseling sessions. All of that is still open to you.
Thank you.
Thank you, Lauren.